Addiction is a chronic, relapsing brain disease that is characterized by compulsive drug seeking and use despite harmful consequences. So let's look at that definition a little closer. The first thing that jumps out is the word chronic. You're not addicted for 6 months, magically cured, and then you're not an addict anymore. These addict tendencies are in the genes, so your genes don't change, and so addiction doesn't just magically go away, even with good treatment. So addicts deal with their disease for their whole lives. The next thing that kind of jumps out in that definition is the word relapsing, and what we mean by that is that an addict can go to treatment, they can get clean and sober, and live for years, decades even. But for some reason, some stressor in their life, and sometimes for no good reason at all, they can go back to their drug of choice, alcohol or drugs, and they can relapse, which means they start using their drug of choice again. And that's why addiction is such a sneaky disease, because it tells the addict, you're okay. You can do it again, or you can have this one drink. It's not going to hurt anything. And then they're off to the races, and they relapse. And so that's what we mean by the term relapsing. Treatment of addiction is like with any disease that affects someone's life. It has to be diagnosed and then treated. So your question is, hey, once we get a diagnosis, what in the world do you do then? The first typically is detox or detoxification. Next is inpatient hospitalization. After that, the addict goes to partial hospitalization, and then intensive outpatient, finally to outpatient, and then aftercare, and then sober living, and then independent 12-step recovery.
So how do people get into treatment? How do you start this whole process?
Sure. There are many ways. One important and interesting way is an intervention. These things are filmed and put on television now, and you can watch them on the internet and things like that. But what an intervention is you have a person who leads this effort, usually a social worker or a psychologist, sometimes a physician, but not usually. And all the family members, and sometimes friends, family members and close friends, will all get together and they'll discuss the addict. And they're encouraged to write letters, for example, to the addict to tell them how their addiction has made them feel through the years. And they all get together in a room and they tell the addict, hey, we need you to come to this place at this time. And sometimes they have to fib a little bit to them to get them to come. But they come there, they see, holy cow, these are all my friends and family. And if they have the courage to sit down, they listen to these letters, they listen to these messages. It's often very emotional, and the way interventions are designed is that very day, after you're finished with all of the sharing, that person there's a plan for that person to enter treatment. So they go straight from the intervention directly into treatment, or like we talked about earlier, to a detox type situation, and then treatment as they get better and better.
Do they do that involuntarily?
No. It all depends on the addict ultimately asking and accepting help. And sometimes they don't. Sometimes they go to an intervention and they say, thanks guys, but this is not a problem for me. I'm doing just fine, and they run out the door. And that person just wasn't ready to be helped at that time. And unfortunately, some situations like that, they just haven't reached their bottom. And sometimes it takes a big life event, a suicide attempt, loss of a job, loss of a marriage, to take that person to a bottom where they throw their hands up and say, I need help. I don't know what to do anymore.
Do they always have to hit that bottom?
Not necessarily. Some people are fortunate in that they have what's called a high bottom, and so maybe somebody at work smells alcohol on their breath, but they're a great employee, and they're, they have a good marriage and supportive kids, and they decide, hey, I'm drinking too much. If they can smell it at work, I'm going to get some help. Sometimes people do that. Unfortunately, the way with addiction works, they very often have to hit a deeper bottom. The intervention is just on one side of the scale, and it goes all the way to the other side, which is, someone keeps their job, keeps their marriage, keeps their relationship with their kids, but goes to treatment because they just don't want to live that way anymore. So there are all types of bottoms. There are all types of ways to get into treatment. Now, some people are mandated by the court system. You get a DUI or two, and the court system's going to tell you, we want you in Alcoholics Anonymous, we want you in a treatment center, and those people aren't forced to go, but it's made clear to them that it's going to be in their best interest if they seek treatment. Many times it works, sometimes it doesn't, and it's different for every individual.